So this morning we will be continuing our discussion about the antihypertensive agents. We are done with the diuretics. We are done also with our centrally acting sympathoplegics and our adrenergic agonists. So we will be moving on. We are now sa beta adrenoceptor blocking agents, or this is what we call the beta blockers. Okay, I believe you are very familiar about our beta blockers because we are done discussing them sa ato ang mga katong chapter, I cannot remember, I think that's chapter 7 sa last nato, Pharmacology 1, atong mga adrenergic antagonist nato. But we are now focusing sa beta blocking agents nato, or sa ato mga beta blockers as drug used for hypertension. Now, clinical applications of our beta blockers, they are our treatment option for our hypertensive agents with concomitant heart disease or heart failure. So again, these are option. Our beta blockers are our option drugs to be used for patients with hypertension, especially if they have concomitant na sakit na sila. Aside from hypertension, they also have heart disease or heart failure. That's the time we use the beta blockers. Now, our first drug na discover na beta blocker is the propranolol. Let me correct it. It's propranolol. Kindly add R here. Propranolol. Our innovator drug. Our first drug in the market is called Inderal. Now, this is again the first blocker na na-discover that is effective in hypertension and also sa ischemic heart disease. By the way, class, if you hear the word ischemic, it means there is lack of supply of oxygen, so especially in the heart. So when is the time there is lack of supply of oxygen in the heart? If there is obstruction in the arteries that carry the blood, the oxygenated blood. So kung naay mga obstruction like naay mga atherosclerotic plaque or naay mga clots in the arteries that will impede blood flow, that will result to ischemic heart disease. There will be lack of supply of oxygen in the heart. But take note, class, that propranolol is non-selective. When you say non-selective, it can inhibit both beta-1 and beta-2 receptors. So non-selective siya na blocking agent. Anyway, we will be classifying our beta blockers later again. Now, how do we know that the propranolol is effective? First, we have here resting bradycardia. If a patient is given propranolol, we know that the drug is effective if the patient will experience resting bradycardia. What do you mean by resting bradycardia? If the patient is not doing anything nga nag-require of so much energy, so nag-rest lang siya, and then there is bradycardia. When you say bradycardia, it's what do you mean by bradycardia again?
Slow heartbeat, ma'am.
Okay, slow heartbeat. What is our normal heart rate? What is our normal heart rate again? Anyone? Heartbeat or heart rate? What is our normal?
60 to 100, ma'am.
Okay, very good. 60 to 100 beats per minute. That's our normal heart rate, class. Do not forget that. It's 60 to 100 beats per minute. Okay? Now, when you say resting bradycardia, if the patient is at rest, iyahang heart rate is less than 60. Again, less than 60. We call it bradycardia if the heart rate is less than 60. And there is reduction in heart rate. That's parehas lang during exercise. So even if the patient is not resting, he or she is doing like exercise or anything that requires so much energy, still there is a reduction in heart rate if he or she is taking propranolol. Okay, that's how you know that the drug is effective for the person. Because remember, when you say beta blockers, the target here is the beta 2 receptors found, beta 1 receptors found in the heart. And since this is antagonist, blocker siya nga drug, so expected good class nga ang iyahang effect is slowing down of the heart, slowing down of the contraction of the heart and slowing down of its pumping rate. So mag-reduce yun na siya both when the patient is resting or doing an exercise. Now for the dosage regimen, propranolol can be given up to twice daily. It depende. There are patients na once a day. There are patients na twice daily depending on their body weight, depending on their need for the drug. Okay? Now, toxicities. Actually, the effect, when you say side effect, right, it's the extension of the pharmacologic action of the drug. So when you say the drug causes bradycardia, it can slow down the heart, meaning it can also be its toxicity or it can also be its side effect. So for some patients, they cannot tolerate the decrease in the heart rate, so that becomes a side effect. So we have here the bradycardia. There will be peripheral vascular insufficiency. So remember that we are slowing down the heart when we give beta blockers. Therefore, there will be insufficient blood supply. So that's what we call peripheral vascular insufficiency. And at the same time, it can mask hypoglycemia effect of our hypoglycemic agent. What do you mean by hypoglycemia? Anyone here knows what happened to a patient if he or she experiences hypoglycemia? Meaning there will be low blood sugar. What do you think will happen to the patient?
Mahilo, ma'am.
Mahilo. Okay, what else? That is correct. Mahilo gid na siya kay kulang ang sugar. And remember, sugar, the blood sugar is our number one source of energy. So definitely if you experience hypoglycemia, mahilo gyud ka. What else? Yes, Mang Luya? There is sweating. Tama na siya, Laida. There is sweating. Yes, Jonabel, what was it?
Mood swings, ma'am.
There will be mood swings. Yeah, for some people, there will be weakness or dizziness. That is correct. Aside from that, sweating, that is also true. If a person class is experiencing hypoglycemia, there is excessive sweating. So I know someone, I heard someone na nag-hypoglycemia, na grabe ang iyahang sweat, na iyahang sinina, pwede na kumutan mo ra ng laba niya. Pag kumutan nimo siya, daghan og tubig, kay mag-sweat gyud pag maayo. There will be trembling also. And actually what I'm looking for is this one, Sarah, the palpitation. A person class experiencing hypoglycemia also experiences palpitation. Thus, there is anxiety and stress. So that is also correct, Christine, na nagapalpitate ang patient. Now, ano mo na akong ginapangita nga answer because that is the one, that is the effect of the oral hypoglycemic agents that can be masked when you are using the beta blockers like the propranolol. Okay? So, tama na siya, nervousness and irritable sila. Now, nga naman mamask, di ba, pag maghatag kag oral hypoglycemic agents, example, metformin, you're very familiar with metformin. Ang metformin class, grabe kayo na siya makapababa og blood sugar. So, paghatag nimo sa patient, magbaba pag maayo iyahang blood sugar, and the patient may experience hypoglycemia. Now, you have enumerated the signs and symptoms of hypoglycemia. Isa din ha ang palpitation. Now, how about if the patient is diabetic and at the same time na siya either hypertension or even heart failure nga gitagaan siya og propranolol? So paghatag nimo sa metformin, nag-hypoglycemia na ang patient, mamask niya tong palpitation nga ma-feel sa patient. Kasi remember, propranolol will cause bradycardia. So dili na nato karon ma-confirm if without the testing, without the laboratory test, if the patient is really experiencing hypoglycemia due to the drug, kay wala na, na-mask na siya, natabunan na siya sa effect ni propranolol. So this is the reason, class, as much as possible, again, as much as possible, if the patient is like taking oral hypoglycemic agents for his or her diabetes, we don't give it concomitantly with the beta blockers. Dili nato siya isabay sa beta blockers so that we can keep track of the condition of the patient kung nag-hypoglycemia na ba siya or wala. So again, as much as possible, as pharmacists also, we should know that we don't give concomitantly the OHA and the beta blockers. Okay? Now, for propranolol and other non-selective agents, we don't give them also to asthmatic patients. Because remember, propranolol is non-selective. It can also inhibit the beta-2 receptors found in the bronchioles and the lungs. And once inhibited, this will cause bronchoconstriction, and that will not be helpful for asthmatic patients. So do not forget, again, aside from we don't give propranolol concomitantly with the oral hypoglycemic agents, we don't also give these drugs to asthmatic patients. I'm talking about the non-selective beta blockers like the propranolol. Now, we also have cardioselective beta blockers. When you say cardioselective, their affinity is more on the beta-1 receptors. They don't usually block the beta-2 receptors. So these are the drugs that we can exceptionally use for asthmatic patients. Like the asthmatic patients have hypertension or nasya heart failure, muna sila ang mga drugs na pwede nato ihatag. So we have here the Bama-ECB, betaxolol, atenolol, metoprolol, acebutolol, esmolol, ciprolol, and bisoprolol. These are the cardioselective beta blockers. So as pharmacists, we should know these things. We should know kay naay mga conditions nga dili sila pwede ihatag o naay mga conditions nga sila lang ang pwede ihatag. Just like the cardioselective beta blockers. We give them to patients na hypertensive or naay heart failure or naay sakit sa heart na naay asthma. Pwede ra kayo nato ni sila gamiton. Now, metoprolol and atenolol, silang duha ang beta blockers nato na widely used in the treatment of hypertension. So mo ni siya ang pinaka ginagamit, and this is the reason why daghan ang mga silingan nga naga-prescribe ani sa ilang silingan. Parehas anang high blood ka, ang akong ginagamit kay Neoblack. Neoblack is a brand name of metoprolol. So mo na sundog-sundog na dayon. Pero actually mao gyud ni siya ang pinaka ginagamit, gina-prescribe sa mga doktor ang metoprolol and atenolol. Nagsanga-sanga na lang ni siya tungod sa mga silingan. Pero actually, if you are hypertensive class, you have to consult the doctor. Kailangan ka i-diagnose properly and kailangan ka hatagan og correct na drug with correct dose and correct tanan. Right dose, right drug, right dosage regimen, right dosage form. So dili pwede nga ang silingan lang ang naga-prescribe. Okay? So, our metoprolol, our innovator drug is the Lopresor. Neoblack is just one brand, but the innovator drug is Lopresor. It is equipotent with that of the propranolol in blocking the beta-1 receptors. So remember, our first drug na beta blocker is the propranolol. So mao na siya ang ginagamit nato for comparison, but nevertheless metoprolol has the same potency with that of the propranolol when in terms sa pag-block sa beta-1 receptor. Now, we use metoprolol for both hypertension and even for cardiac failure. So, ang mga patients nato with cardiac or heart failure, pwede nato gamitan or hatagan og metoprolol. That's the same thing. Yes, Jonabel.
May question ako.
Okay.
Kung mag-inom lagi, ma'am, like, Neo Blackwood, ma'am, nagareklamo lagi sila, ma'am, na nagasakit daw lang
Ilang?
ulo, ma'am. Sakit daw lang ulo.
Nagasakit ang ilahang ulo? Okay.
Yes, ma'am.
For some reason, beta blockers have effect also in the blood vessels. Again, they have also activity sa blood vessels. So they can actually dilate the blood vessels. And remember, di ba itong nag-istorya ta og headache last sa PCOL 1? Headache is actually due to the vasodilation sa ulo. Ang mga blood vessels sa ulo nag-dilate, causing the stretching of the pain receptor sa ulo. So that can be the reason why magsakit ang ilahang ulo. That is due to the vasodilation nga apil ang sa ulo class. Mahimo na niya class og side effect because that's an extension of its pharmacologic nga effect. So mga gina siya ang reason. Yes, Jai.
Ma'am, may mga pasyente po lagi na nagsabi din na parang same daw yung symptoms ng hypoglycemia tsaka hyperglycemia. Kaya nalilito daw sila kung ano daw yung prevention na gagawin nila.
Sige. Let us differentiate the two, ha. What happens sa imuha kung nag-hyperglycemia ka? What do you know about hyperglycemia? Anyone? Okay. Palaging uhaw. That is correct. Majeda. What else? Wala na? Anyone here who has observed a patient with hyperglycemia?
Sigig pangihi, ma'am.
Sige pangihi, sige uhaw. Sige. Actually, class, sa hyperglycemia, we have polyuria, polydipsia, polyphagia. So when you say polyuria, masige na silang pangihi, especially sa gabi eh. Tapos polydipsia, sige na silang uhaw, kay sige man silang pangihi. And then, there is polyphagia, sige sila gutom. So siguro din ha sa sige sila gutom, ang parehas, gutom ka. Gutom ka pag nag-hyperglycemia, kapag nag-hypoglycemia ka, gutom gihapon ka. So that's the similarity there. Pero masige man gud na sila pangihi kay ang sugar man gud class, na man gud na siya osmotic na activity na pag ang sugar naa sa blood or naa sa urine, musunod si water. Wala sila man sige pangihi. Okay? And yeah, those are the pinaka-common nga symptoms. Polydipsia, polyphagia, and polyuria. There will be, pagtaas na gyud kaayo kana, pwede na sila malipong. So, diha na po ang similarity with that of the hypoglycemia. Kanang manlabo ang paningin, that can also be true. Pero dito na siya sa taas kaayo nga sugar. Pero actually, most of our diabetic patients, usay wala sila ginabati. So they actually don't know that they have diabetes, that they have hyperglycemia. Wala kaayo, kana lang mo polydipsia, polyuria, and polyphagia. Wala na siya. The rest man good na mga like vision problems, dito na basta severe na kayo. Okay, pag severe na kayo. So para sa ako ang classmate, my high school classmate died I think last month. So ano siya, bago siyang panganak, 4 months pa lang iyang anak, namatay siya. Mikalit lang siya katumba. Mikalit lang siya og katumba and dito na ICU na siya, nakumatos na siya dayon. So diabetic day siya, tas wala siya kabalo and na kidney failure na siya. So wala kaayoy mga aside from the three nga piece akong giingon ha, mamayat sila kalit na wala sila nag-diet. So kato dugay mo wa nagkita. So wala ko nag-expect taba man gusto siya dati. So wala ko expecting ato na siya kapayat. So there are people class nga mamayat tas wala nag-diet murag makulbaan na. Pwede na siya tungod sa taas kaayo nga sugar. Pag ano pero mas delikado kasi ang ano class, ang hypoglycemia. Pag mubaba kayo yung sugar diretso mo ka na lipong, comatose, death. Unlike sa hyperglycemia usahay kanang wala kay gibati unless na lang og mag-complicate na siya. Yeah, wala kayo ma-feel ang mga tao nga naga-hyperglycemia. Unless na lang mag-complicate na, maapektuhan na ilahang eyes, apektuhan na ang ilahang kidneys, kana or magkaroon na sila og like wound na wala nagahil. So diha na nila mabalaan nga oy taas na day kayo ang ilahang sugar. Pero pag hypogly, pag dili mo maagapan ang hypogly, kumatos gyud na siya diretso. So mas pisod ang hypogly kay pag dili maagapan patay. Ang hyperglycemia bisag ma-shoot up pa 400 inom gihapon coke. Lados lagi bati. Okay? Sige. So let us continue. We have atenolol class. Unlike the propranolol, atenolol is given once a day. But this is less effective than metoprolol. So mo na ilahang kalahian, though they are both used for hypertension and for cardiac failure also. Now, since atenolol is excreted via the urine, we give lower dose for patients with renal failure because they might not excrete efficiently this drug if naa sila'y sakit sa kidneys o makasamot pag yun siya gaguba sa kidneys. Those are the things that you need to remember about atenolol. So tenormin ato ang innovator drug that we have a lot of brands in the community. Now, those are the cardioselective ha. Our non-selective beta blockers in addition to propranolol. Propranolol magyud ang number 1 din ha. So in addition, we have the nadolol and the cartulol. Brand names nang naa sa open and close parenthesis ha. So ang inyong tandaan sa beta blockers whether they are cardioselective or non-selective. And at the same time, we have the third classification, the partial agonist. What do you mean by partial agonist? They are beta blockers, so supposedly they are antagonists of the receptor, but they have this partial agonist na action. So they are beta blockers, but to some extent they have like intrinsic na agonist activity sa receptor. So we call that intrinsic sympathomimetic activity. Blocker sila pero to some extent, kaya nila i-activate ang receptor pero partial lang. They cannot activate it fully. So what are these partial agonists? We have the pindolol, acebutolol, and penbutolol. So that, again, these are our partial agonists. Yeah. So that's the meaning of partial agonist, drugs that bind to and activate a given receptor but have only partial efficacy at the receptor relative to a full agonist. That's correct, Tin. Next, we have here mixed acting beta blockers. So pag mixed acting na siya karon class, ilahang activity is not just only to the beta receptors, but they also have activity sa alpha receptors. That is why they are called mixed acting beta blockers. And you will know them sa ilahang name. They don't end with olol. Kasi di ba our beta blockers end with olol. Metoprolol, propranolol, olol yun na iyahang ending. But basta mixed acting na sila'y activity sa alpha receptor, wala na sila nag-end sa olol like labetalol, carvedilol, and nebivolol. Okay? So kaya nila mag-antagonize po og alpha receptors. Yeah, partial example lang na sa mga partial agonistin pero those are other categories. Okay? Question so far about the beta blockers? Ako na mag-question. What is again our drug of choice for hypertension in pregnant women? Again, what is our drug of choice for hypertension in pregnant women? Very good. It's methyl dopa.
Methyl dopa.
Okay. Brand name is Aldomet. Now, if Aldomet or methyl dopa is not available class, labetalol can be also used for hypertension in pregnant women. So, duha lang na sila, labetalol and the methyl dopa. So, do not forget that. And then, aside from that, labetalol is also useful in treating hypertension of pheochromocytoma and hypertensive emergencies. So why is pheochromocytoma included here? Remember, labetalol is mixed acting na beta blockers na apod siya inhibition on the alpha receptors. So di ba ang ato ang pheochromocytoma, we have here tumor on the adrenal medulla. And that tumor will release a lot of norepi and epinephrine causing hypertension to the patient. So since alpha receptor man jud ang kanang main nga receptor for the norepinephrine na mag-lead into hypertension, pwede kayo sila labetalol gamiton dito. Kaya niya i-block. And at the same time, hypertensive emergencies. What again is the blood pressure of a person para matawag siyang hypertensive emergency? Sa indication para hypertensive emergency siya? So, ganito kung ingon sa inyo last time. Pakalimot na ni sila.
Yan yung 180.
180 over
25.
180 over 120. 180 over 120 usahay 180 over 125. Yeah. And take note, since this is emergency, di ba pag emergency na ay end organ failure. Di ba ang ako ang gidiscuss sa inyo ha, ani. Natay ginatawag og hypertensive crisis. Patawag na siya hypertensive crisis if ang BP is 180 over 120 or higher. Now, natay duha ka klaseng hypertensive crisis. The hypertensive urgency and number 2, hypertensive emergency. So, ang kalahian na nila class, si hypertensive emergency, mao na tong ang imuhang BP is more than, equal or higher than 180 over 120. Pero pag hypertensive emergency, the BP is still 180 over 120 or higher, pero plus organ failure. Muna ilahang kalahian. But ano na sila? Types of hypertensive crisis. So do not forget that. Urgency o emergency ha. Now carvedilol, this is another na mixed acting beta blockers. Usually ang dose ana niya for ordinary hypertension is 6.25 milligrams twice a day. So twice a day, 6.25 milligrams. Pero duha ni siya ang dose sa market, 6.25 milligrams and the 12.5 milligrams. But you can give this for hypertension, and at the same time, most of the patient with cardiac failure is given carvedilol. So, wag gini ang pinakaginagamit when it comes to heart failure, the carvedilol. I cannot remember the brand name sa market na uban. Ang ako maalala na lang kay ang Carvid. Carvid, kay hapit-hapit man siya sa iyang pangalan, Carvid or carvedilol. Okay? And then, nebivolol na siya vasodilating effects that may be due to an increase in endothelial release of nitric oxide. So remember, we have substances in the body that maintain homeostasis to balance the blood pressure and regulate the blood pressure in the body. We have the endothelin and the nitric oxide. When you say endothelin, it can cause vasoconstriction if baba na kaayo ang BP. But if taas na kaayo ang BP, the one that is being released in the body is the nitric oxide. Pinana siya vasodilating na activity. And that nebivolol has vasodilating activity or effect that can be attributed to the release of the chemical nitric oxide. Endothelial meaning our own blood vessels will release this substance and will cause vasodilation. And lastly, we have the esmolol, the Brevibloc. So from the name itself, esmolol, you should have a hint that this has the smallest half-life or the shortest half-life among the beta blockers na 9 to 10 minutes lang class iyahang half-life. After 10 minutes, half of the dose will be excreted, half will be left in the body. That's how short its half-life is. Thus, we cannot give this orally. We give esmolol by constant IV infusion. So mura siya himuon og IV fluid like mga dextrose nato. Nga na nato paghatag si esmolol. Constant siya na intravenous infusion that is due to its very short half-life. Now, when do we use esmolol? This is used for the management of intraoperative and post-operative hypertension. So like during operation, surgical operation, the patient experiences increase in the blood pressure, then maghatag-tag constant IV infusion of esmolol. And that is also true after the operation. So sometimes ginagamit po siya for hypertensive emergencies, particularly if associated with tachycardia. Ano siya? Kay IV infusion man siya, emergency. So taas kaayo ang blood pressure sa patient. Thus, pwede siya ihatag via IV infusion. Mas dali man po siya mo epekto, di ba? Basta ginahatag intravenously. Another thing that you have to take note about esmolol, this is our drug of choice for caffeine toxicity. Again, esmolol is the drug of choice for caffeine toxicity. What happened to a person if there is caffeine toxicity? Sobraan ng caffeine. Kasi may experience number 1.
Palpitation.
Palpitation. So thus, since the patient experiences palpitation due to caffeine, we can use esmolol to slow down the heart rate. That is why esmolol is the drug of choice for caffeine toxicity. So do not forget that ha, kasi that's a board exam question. We don't have actually an antidote for the caffeine itself. So wala tayo pang kontra sa caffeine sa sulod sa lawas, but we only have symptomatic antidote. Meaning unsay symptoms sa caffeine poisoning, it's palpitation. So mauto-ato ang tambalan. Ano na siya basta symptomatic na antidote. We have esmolol. Okay? Question so far about our beta blockers? Anyone? Kasi nabot na tayo na itong beta blockers class. Or na pa'y nalibog sa beta blockers. Wala naman siguro, no? So let's move on sa atong alpha-1 blockers. Again, where can we find alpha-1 receptors? Major location of our alpha-1 blockers. Again, where is the major location of our alpha-1 blockers? Alpha-1 receptor, sorry. Alpha-1 receptor. What specific smooth muscle is that, Sarah? Sorry, kalimutan na past is past. Gunner? Okay, very good. Vascular smooth muscle. When you say vascular smooth muscle, we are talking here about the blood vessels. Don't forget alpha-1 receptors, major location in the body is in the blood vessel, or that's what we call the vascular smooth muscle. Okay? Okay, may pangutana dahil pahabol. Kapag after kape mo, good ma'am, tapos parang matay ka na agad, ano meaning nun? Actually, class, caffeine has, number 1, a little diuretic effect. So it can actually increase your urine production, but not to the extent nga ginagamit jud siya as diuretic na drug, pero it can increase your urine. And number 2, caffeine has a little laxative na action. So that is actually normal na if you drink coffee, kalibangon kapag kahuman. Na siya nga ng activity. That's normal. Yeah, normal gid kayo na siya nga. Amoy kape mong ihi basta man nangape ka. Just parehas lang yun na siya sa pag-inom kag antibiotic buhos ag tambal imong ihi, because that is the sign that what you drank has been excreted from your body via the urine, ha. What do you mean same as milk, Sarah?
Kanang murag kalibang ka after mo mag-ano, ma'am,
Uh,
mag-inom.
the caffeine has a little laxative activity, but milk plus is dependent in your enzyme. If you have like lactase na enzyme, that's the enzyme that digest the milk. If you have that lactase na enzyme, okay ra ka, pwede ra ka kaayo mo inom og gatas. Bisag kapila pa sa kadlaw. But if you have a deficiency sa lactase nga enzyme, kana dili gyud ka makatolerate og gatas. Kay dili man gud na nimo siya ma-digest. Instead, ang bacteria ang mo-digest sa gatas. Pag ang bacteria ang mo-digest sa gatas, himuon man gud na niya og lactic acid ang milk, ha. And lactic acid is an irritant in our gastrointestinal tract. So that is the reason why kanang mga ano sa tawag na sa ilaha, mga lactase na deficient na mga people, pag mainom na sila og ano kanang gatas sa CR gina sila padulong. Did I answer your question, Sarah? Lactose
Yes,
intolerant
ma'am.
na sila. Ang tawag sila lactose intolerance na mga patient na to. They cannot tolerate lactose because they don't have the enzyme lactase. So naiuban nga wala pa nila nahurot ang isa ka baso sa CR na gid sila padulong. Pila ka cups ang normal na intake sa caffeine? Actually depende sa inyuhang capacity for caffeine, no? The usual is just 1 cup of coffee every day, but to some people, I don't know, they have been addicted to caffeine and murag maglabad nilang ulo di sila kainom. Okay raman noon na siya class to keep you awake, but please do not drink the 3-in-1 kay daghan kay siya sugar. May pa magkape mo nga ano, kanang wala gay sugar. Sa wala mong gugay ng kape ba? Kana. Actually, caffeine is, number 1, it can keep you awake. Number 2, it can actually decrease the viscosity of the blood. It can actually help our blood flow. The caffeine, ha? Pero again, do not use na the one na daghan kay sugar. ang nangutana ba ana kay si Isabel na siya, oh, ma'am, pila ka cups ang normal na intake sa caffeine, asking for a friend. Ang friend kay siya.
Nahiya lang siya, ma'am, na sabihin na siya.
Sa mukha. Dapat isa lang man jud na. Pero please do not drink coffee na walay unod inyong tiyan, ha. Because coffee is acidic. It can cause hyperacidity. So kailangan nagyud mo is something before mo magkape. Like tinapay, ana. Private chat niya kay gilaglag man kaning Majeda. Actually wala ko naka-realize kung wala na ingon si Majeda nga si Isobel magsakit ulo pag di Bakit sa morning nagakape? Because coffee, the caffeine can activate your like brain. Stimulant man gud na siya. So to keep you active the whole day, that's the use of coffee. Pero mo na siyang ginaingon nga ayaw mo pagkape gabi kay di mo makatulog na. Medyo na siya ang problema. Kahit wala laman ng tiyan, mo nang ginahimo sa mga tao mostly, pero they don't realize that it will be causing hyperacidity pag walay sulod imong tiyan. So pagkaon mo bisag tinapay lang. Pag ang iba makatulog pag magkape sila, it's either their body is used to caffeine already, that their receptors are not sensitive anymore. So dili na sila makamata. Ako kay wala man ko nagainom og kape, lakas tama gyud kay na siya sa ako class kanang kape. Kay mata gyud ko ana tibok adlaw hangtod gabi mata paghihapon ko di na ko katulog. Thus, I don't drink coffee and nagbulag hapit na may magbulag sa milk tea. Kaya I cannot tolerate the milk tea also. I cannot sleep. Makatulog ko mga alas 3 na kanang hapit na ko makahilak nganong dili ko makatulog. So, I don't like caffeine. Oh, ang kopi ko 78, di ba gipanghatag na nila sa una tas daghanog namatay ana, di ba? Ng mga bata. Ang kopi ko 78. Kay it's very strong. It can really increase the heart rate. That's the effect of caffeine man good. May certain cycle. What is the certain cycle? You don't daghan og bata kay I think 'di ba tong pagawas anang kopi ko 78 murag naghatag sila mga kanang mga free taste niya dito sa mga elementary schools. So daghan namatay ana.
Ma'am, di ba namimigay din sila pag yung malapit na good mag-expire? Lalo na yung mga 3-in-1 sa mga
Oh.
student.
Oh, kana sad. Pero be careful with the kopi ko 78. I think it's very strong. It can really keep you awake the whole day. But the problem here is if you are sensitive to caffeine, it will really give you palpitation. So the last time I drank coffee was when we went to Davao at 6 a.m. and I need to drive. So, mo to siya giantos gina ko ang kapait sa kape. Dili jud ko ganahan og kape man jud good. Number 1 nga nung wala ko nagainom is dili na ko gusto ang lasa. So giantos na ako just to keep me awake na mag-drive kasi whole day mag-drive pabalik pa. Pero do salitan mi sa kumanghod pero I really need to be awake. So that was I think the last time I drank coffee. The milk tea noon, naghimo-himo ko milk tea tong niagi kay gitudluan ko ni Mamabe. Paano siya nagabuhat og isa ka pitsil na milk tea. Akong gisundog. So, naghimo-himo ko pag human ako inom, makahilak na ko sa dili ko makatulog. Kahilakon jud ako basta dili ko katulog kay dapat matulog yung ko labi na 7:30 akong klase. Dili na ko kaya klase walay tulog. Unsa daw? Daw sa kayo subet. I don't even drink coffee during the exams. When I have exams, I don't drink coffee. I sleep early. I wake up early so that I mean I need to have like enough sleep to keep me awake. I don't drink coffee because I will experience palpitation. I cannot concentrate sa exam. So kamo ko na matolerate ninyo yung kape, gora lang. Ang ako lang yung hangyo kay ayaw ninyo butang igdaghang asukal. Kana lang. Sige, let's continue. Alpha-1 blockers. You are very familiar with this. Alpha-1's major location in the body is in the blood vessel. And once activated, the alpha-1 receptors can actually cause vasoconstriction, thus leading to the increase in the blood pressure. So this is the reason why we can actually block the receptor para tambal siya sa hypertension. So, muna itong mga alpha-1 blockers. If the beta blockers end with olol, the alpha-1 blockers end with zosine. So, doxazosine, prazosine, and terrazosine. So, from the name itself of the group of drugs, makita na ninyo daan ang ilahang mechanism of action. They selectively block the alpha-1 receptors. Again, they are selective sa alpha-1 receptors. They don't really include the alpha-2 receptors. Unlike our beta blockers na ay cardioselective na ay non-selective. Yeah, the zosines aside from the wait lang, kinag-chat mo. Anyway, ang mga zosines na to, we can give them for hypertension, but actually their use for hypertension nowadays has diminished. Instead, they are most likely used for BPH, benign prostatic hyperplasia. Because to some extent, they also have activity in the prostate of the male, Kay naapoy daghan nga alpha-1 receptor din ha, and once nga i-block ang alpha receptor sa prostate nila, it can lead to the relaxation of the prostate muscles. So man makatabang siya sa benign prostatic hyperplasia. Pwede ba mag-take ang patient og Zosyn for BPH o another antihypertensive agent kasabay? Actually, yes. You can do that, especially if nalisdan mag-control sa blood pressure sa patient. So kailangan niya another drug. So mahulog na siya og polypharmacy, but we need to keep track, we have to monitor the blood pressure of the patient kay it may lead to hypotension na. Kung grabe-grabe na gyud, mag-hypotension na ang patient ana. So yes, pwede, depende sa need sa patient ha. Pero kung dili man nga to katas iyang BP tapos na pa siya BPH niya, kaya ra sa Zosyn na lang. Para 2 conditions in one drug na siya. Okay, so what are the effects of our alpha-1 blockers? We have number 1, prevent sympathetic vasoconstriction. Again, prevent sympathetic vasoconstriction. That's the activity if we block the alpha receptors in the blood vessels. And number 2, reduce prostatic smooth muscle tone. So this is the reason why, again, they can be used for benign prostatic hyperplasia. They can relax the prostate smooth muscles. And then they are more effective when used in combination with other agents. So this is the answer to your question now, Isobel. Most of the time, the Zosyns are being combined with the beta blockers and the diuretics. So mo na siyang mostly combination nga ginahimo para mas maging effective ang drug. Pero again, you have to monitor the BP of the patient. Basi grabe ang shoot down sa BP, mauwi na siya sa hypotension. So just like the hypoglycemia, mas delikado pod glass ang hypotension. I mean, delikado silang duha pero mas grabe mo ang effect ni hypotension kay lipong ang patient, pwede siya ma-comatose and so on. Tell me sartan, okay? So you can also give that, the sartans with the Dudart. What is the Dudart? Dudart is dutasteride and tamsulosin, right? Duham na siya katambal kay Dudart. Let me check. Dudart. I think I'm right. Yeah, dutasteride and tamsulosin. Pwede ra na gamiton for that. So clinical applications, duha lang po yun na siya, hypertension and benign prostatic hyperplasia. So this is where the prostate sa mga lalaki, hyperplasia means there is increase in the number of cells in an organ leading to the increase in the size of the organ. So mo na siya. Pero benign lang, dili siya cancerous. Ang problema sa BPH, if left untreated, pwede manggod siya, yes, mauwi into cancer sa prostate. Okay? Now, adverse effects. This one is our problem with the Zosyns. The first one is first dose syncope. If it is the first time sa patient mo inom og alpha blockers, mag-experience gid siya first dose syncope na pag inom niya first sa iyang first dose malipong gyud siya. Ing ato ka grabe ang activity ni alpha-1 blocker na grabe ang pagbaba sa blood pressure nga na malipong siya. That's what we call first dose syncope or first dose phenomenon. So to avoid the first dose syncope, number 1, we can give the drug at bedtime para kanang tulog na siya, dili na siya malipong within the day. And number 2, we taper the dose. When I say we taper the dose, we start with half of the prescribed dose and then we just increase it after some time hangtod ma-achieve na to ang kanang dose gyud nga gi-prescribe sa patient. So dili pwede nga mo diretso ta sa dako nga dose nga first dose pa lang sa patient, lipong gyud na siya na class. And this one is a side effect. This one is this should be called adverse effect. These are side effects class. Orthostatic hypotension. This is just an extension of the activity of the drug. Orthostatic hypotension. And then other alpha adrenoceptor blocking agents, kani sila selective, kani mga zosins, please include the tamsulosin, though wala siya nag-end sa zosin. Mga selective ni sila sa alpha-1. Kani mga non-selective, meaning they can block both alpha-1 and alpha-2. We have the phentolamine and phenoxybenzamine. I believe I am done with the discussion about this sa PICOL 1. Both drugs are used for pheochromocytoma. Again, pheochromocytoma na silang duha. Questions so far sa ato ang mga antihypertensive agents? Bagon lang yun ako ni si Madam ha. Wala pangutana. So let's move on sa ato ang mga vasodilators. So from the name itself, vasodilators, directly they will cause the dilation of the blood vessels. Napaunsa inyong tandaan, pag na-dilation sa blood vessels, class, it will lead to the decrease in the blood pressure. So these vasodilators are also used for hypertension. However, the vasodilators are classified into two. We have the oral and parenteral vasodilators. Ang inyong tandaan, pag oral, syempre kay oral man siya, ginagamit siya as maintenance drug. Okay? So para siya sa long-term outpatient therapy sa hypertension. Now, what are the examples of our oral vasodilators? We have the minoxidil and the hydralazine. We will discuss them one by one later. And then we have parenteral vasodilators. Kani sila, since parenterally given, we cannot really give this outpatient and we cannot give it as maintenance. Therefore, parenteral vasodilators are used to treat hypertensive emergencies. So if the blood pressure is like 180 or over 120 and higher, and like there is an organ failure, the patient needs to be hospitalized, that's the time we use the parenteral vasodilators. So we have three examples here: nitrocrucide, diazoxide, and phenoldopam. Now, aside from the given here, minoxidil and so on, calcium channel blockers are also considered as vasodilators, but their mechanism of action is on the calcium receptors sa blood vessel. Remember, the blood vessels are also muscles, smooth muscles sila. And in your anatomy and physiology, you are taught that muscles need calcium in order for them to contract. Pag ang blood vessels class mo contract, it means mo constrict na siya. Pag contract ana niya manggod, syempre mo contract ang muscle, ang agianan sa blood mo gamay. Mo na contraction of the blood vessel leads to constriction, and it will lead to increase in the blood pressure. However, if we inhibit the calcium channel, wala dili maka-act calcium, so there will be no contraction of the blood vessel. That's the use of our calcium channel blockers, or we abbreviate it as CCB or CCBs. And you will know them sa ilahang pangalan. These are the drugs that end with dipin, like amlodipine. What else do you know nga dipin? Amlodipine,
Felodipine, ma'am.
felodipine, nicardipine, nifedipine, at ang mga nag-end sa dipine, they are all included sa calcium channel blockers. And like you know them, right? Amlodipine is very much used for hypertension. So again, it's considered as a vasodilator. And we also have the nitrates, but instead, nitrates are actually used for angina. It's not really that much used for hypertension, but it's used for angina. When you say angina, it's chest pain. Okay, very good. It's chest pain class. Anyway, we have a separate chapter for angina. Now, let's talk about their mechanism of actions, because these vasodilators have different mechanisms of actions. Number 1, for nitroprusside, hydralazine, the nitrates, and even the histamine and acetylcholine ha. So kana sila ng mga substances, they are not really used as drugs for hypertension, but nevertheless they can also decrease our blood pressure. Their mechanism of action is on the release of nitric oxide from the drug or the endothelium. Okay, kanina mga drugs nga na-mention diri, number 1, they can either be metabolized in the body and produce nitric oxide as metabolite. And the nitric oxide, remember, can cause vasodilation. Or number 2, these drugs here can trigger the blood vessels to release its own nitric oxide. As long as there is nitric oxide class, there will be vasodilation. And then again, that's the action of these drugs here enumerated in the table. Next, we have the calcium channel blockers. I have mentioned this one. These drugs end with dipin in their names, and that they inhibit the calcium channels para walay makasulod na calcium sa mga muscles, like sa blood vessels na muscle, and there will be no contraction. And pag walay contraction, there will be vasodilation, walay increase in the in the blood pressure. Next, the third one, we have minoxidil and diazoxide. By the way, they are not grouped according to whether they are orally given or parenteral. They are grouped according to their mechanism of action. So like minoxidil is oral while diazoxide is parenteral. But they have the same mechanism of action, and that is hyperpolarization of smooth muscle membrane through opening of potassium channels. So what do you mean by hyperpolarization? Na-remember ninyo tong drawing na to sa ingani? Or nag-drawing na ba ko? Or ako rin nakahinomdom. We have potassium here, we have calcium here. Kana ganing sa heart rate nato nga nagataas pag mo flatline, meaning patay na ka. That is actually the work of our ions being manifested in the body. And these ions will actually dictate the activity of our cells. So pag ingani gani pasaka siya, meaning sodium, there is sodium in or influx. Pag musulod si sodium, there will be depolarization. And that when you say depolarization, the inside of the cell will become more positive. Pag mahimo na siyang more positive, di ba? Mahimo na siyang active. Okay? So pag mahimo na siyang active, for example, we are talking about the blood vessels here. Pag ma-activate na siya, there will be contraction. And remember, pag naay contraction, kay naay constriction. Therefore, dirita, hyperpolarization. Pag mayroon kag hyperpolarization, ang drawing na to ana mas mubaba pag yun na siya, kay there will be opening of the potassium channels. Ang meaning na sodium will go out, potassium will go inside. Pero dili man gud na sila parehas og ratio, 3:2 man na siya. 3 ka sodium ang mugawas, 2 ka potassium ang musulod. So definitely the inside of the cells will become more negative. Though si potassium class is positively charged, pero mas daghan man gud ang migawas nga sodium nga positively charged. So munaog ang current sa sulod sa cell, mahimo siya more negative. And pag mahimo na siya more negative, there will be suppression of the activity. Pag masuppress na siya, there will be vasodilation, relaxation of the smooth muscles sa atuang blood vessels. So muna siyang activity ni minoxidil ug ni diazoxide. I-open nila ang potassium channels para mugawas si sodium, musulod si potassium, but the ratio is not the same. So mahimog more negative ang sulod sa cell. We call it hyperpolarization. And it will lead to the suppression of the function of the cells. Pag masuppress ang function sa cells, there will be no contraction. Therefore, walay constriction sa blood vessels, walay increase in the blood pressure. So I hope nagkasinabutaan na. Questions so far? La So lastly, we have the phenolidopam. From the name itself, you should have a hint there that this is an analog of dopamine, phenolidopam. Therefore, its activity is on the dopamine receptor. So there will be activation of dopamine receptors. We have a lot of dopamine receptors, but these receptors are referring to the receptors that govern the activity of the blood vessels. So when it is activated, this specific dopamine receptor can actually relax the muscle of the blood vessels, causing dilation. Okay, so mao na siya tanan karon ang mechanism of actions sa atong mga vasodilators. Now let's talk about these drugs one by one. We have the first one here, hydralazine. We have the innovator drug in the market, apresolin. Now, what you have to take note about hydralazine, it can only dilate the arteries but not the veins. So, di ba, ang atong mga blood vessels, we have the arteries, we have the veins, we have the capillaries. But for hydralazine class, ano siya, more on the arteries siya. Kasi kalahian sa veins o sa arteries class. Kasi kalahian nila. Anyone? Bang nagapang lotion ko din hikay. Dry kayo kung kamot. Anyone who knows the difference between the arteries and the veins?
Ma'am, pag arteries, they carry oxygenated blood, while veins, they carry deoxygenated blood.
Okay, very good. Pag arteries class, they carry oxygenated blood. Meaning na ay oxygen. So kung na siya yung oxygen, gikan na siya sa heart. So gikan sa heart, padulong sa body, arteries na siya. Okay, para i-distribute ang oxygen. Pero pag maingon kag veins, it's from the body going back to the heart. Nga naman, gigamit naman to no, gi-use up ng oxygen. So nawala ng oxygen. So the blood will be going back to the heart para mahimo na po siya oxygenated. And the one that carries the deoxygenated blood is the vein. So again, para sa hydralazine, ang kaya niya i-dilate kay ang arteries, pero dili niya kaya i-dilate si veins. Okay? Now, hydralazine is used in combination with nitrates for heart failure. For heart failure, we have separate discussion for heart failure. Okay? Now, take note of the toxicity. So this one is a combination of side effects and adverse effects of the drug. Basta vasodilators gani class, makakos gyud na siya og headache ha. Kaya ang headache is caused by the vasodilation sa ulo, causing stretching of the pain receptor. Nausea, anorexia, pag mangutay kog side effects sa inyo kung inyong answering, nausea and vomiting. nausea and vomiting ha, that is actually true for all drugs. Basta magkaroon og toxicity, nagyod na siya yung nausea and vomiting. And then we have anorexia, dili ganahan og kaon ng patient ani, palpitation, due to actually the decrease in the blood pressure. By the way, if the patient has decreased blood pressure, magpalpitate yun na siya, there will be tachycardia. That will be actually the response of the body sa baba nga blood pressure. Mupaspas imong heart rate to compensate for the decrease in the blood pressure. And then there is sweating and there is flushing. And there is reflex tachycardia and sympathetic stimulation that may provoke angina or ischemic arrhythmia. Okay? So again, the response of the body sa baba nga blood pressure is to increase the heart rate, causing tachycardia, and it may provoke angina. Kay paspas kayo ang heart rate and even ischemic arrhythmia. I will talk about angina and arrhythmia sa next na mga chapters. And ganong naka-bold na siya, kaya mo na siya ang board exam question. Hydralazine can cause lupus-like syndrome. You're familiar with lupus, right? Anyone here who are familiar with lupus? Yeah, sa men? Kasi sa men? Men? Sa mga lalaki? Mas daghan ba ang ginalupos nga lalaki? Yeah, I think so. Mas daghan ang ginalupos nga lalaki kaysa sa babae. Tama ba? I'm not sure with the prevalence though. But when is
Mas siya sa women, ma'am.
mas daghan siya sa men?
Sa babae po.
Sa babae. Baliktad ay. Okay, mas daghan siya sa babae. But you have to take note that lupus is an autoimmune disease. Yes, tama na siya, Rosel. An autoimmune disease na wherein our body's immune system becomes very active that it can attack the organs in the body. Si Selena Gomez, nay lupus si Selena? Yeah, I think si Chris Aquino na. Okay? Si Marcos, President Ferdinand Marcos, mo na ihang gikamatian,
Wala
lupus.
na tong ano dito, no? Tong purok sa bangkay. Wala na na. Wala man may nag-text ako.
Makichismis na ni kay Belly karon. I-mute na to siya. Basig na ni siya iingon karon makabalot ah. Okay, again, lupus, pag lupus ha, autoimmune disease like si Marcos, most of the time, ang mga nailupus, napun na sila arthritis kay gubaon man na sa mga white blood cells, pati ang mga joints. And I think si Marcos is more sa kidneys. So, dito siya nagkaroon ng complication. Si Chris Aquino, I think yan, siya ay lupus. And then they are given immunosuppressants. That is why immunosuppressed sila, dali sila magkaroon ng infection. Yeah. And take note ha, hydralazine do not cause lupus. Instead, the patient may have lupus-like syndrome. Wala dyan lupus ang patient, pero na siya signs and symptoms sa lupus. Actually, the patient will just develop the malar rash or butterfly rash. Malar ha, M-A-L-A-R. Diri. Example sa nawong, mura siya na butterfly nga rash diri sa iyang nawong or any part sa iyang body. And mao na siya ang ginakos ni hydralazine nga usahay murag maalaan ang patient nga na siya lupus. So aside from that, can also cause peripheral neuropathy and the drug fever. Okay? Next, minoxidil. Are you familiar with minoxidil? Anyone? Who is familiar here sa minoxidil? This is an antihypertensive drug. You're not familiar with minoxidil? Minoxidil is actually a component of a lot of hair grower na products. Like Regrow. I'm not sure if you have seen that sa SM, pero may ko na makita. Brand name niya kay... Oh, wait. Brand name niya nga permi na ko makita sa SM kay kani. Regrow, kana color green ang iyahang sudlanan. It's class a hair grower na product. It contains minoxidil. But, board exam question, the original use of minoxidil is antihypertensive siya. Okay? Na-discuss na ako kagain na iyahang mechanism of action ha. Opening of the potassium channel causing hyperpolarization and para dili mag-contract ang blood vessels, muscles. I'm not sure with the genoxidil. Minoxidil. The name of the drug is minoxidil. Ang brand name na pero may nakumakita Regro. I'm not sure with the other brand names though. But shampoo na siya. Shampoo. Shampoo, yeah. Topical use. Kaya kung inumon mo si minoxidil, it will become an antihypertensive drug. But side effect manggod na niya, adverse effect manggod na niya ang kanang hair growing na activity. So karon dili kay kakakitag minoxidil in the pharmacy nga orally taken, but daghan ka ani makita sa cosmetics ang minoxidil. Ibutang lang siya sa like sa skin or most of the time shampoo gina siya. It can, I'm not sure with its mechanism of action because it's an adverse reaction of the drug. So yung pag adverse reaction, you cannot really explain why nganong mahitabo na siya, but nevertheless minoxidil ang iyahang adverse reaction na himo na niya karon og clinical application. So maka-ano siya, maka-increase siya og hair. So ginagamit na siya sa mga grabe ang hair loss. Tapos aside from that, kanang mga male pattern baldness, diba mga lalaki as they age nag-decrease ang ilahang buhok. Pero just like last dihydrolazine, minoxidil can only dilate the arterioles but not the veins. And we also use minoxidil if it is antihypertensive. It is used in combination also with beta blockers, but this time the loop diuretics. Now, let's talk about the toxicity. These are these are given: tachycardia, palpitation, angina, and edema, especially when doses of beta blockers and diuretics are inadequate. Kaya mao gyud ni ang effect ni minoxidil since makababa man siya blood pressure, so mag-experience gyud ang patient na nagtachycardia, palpitation, and angina. That is why ginasabayan siya og beta blockers. And it can also cause fluid retention, and that is the reason why ginasabayan pod siya og diuretics para dili mag-edema ang patient. But nevertheless, mao ni siya mga toxicity sa ato ang minoxidil. Aside from that, we have the headache. Remember, it can dilate the blood vessels, and then there is also sweating. And ang naka-bold class, mao ni siya pirmi ang board exam question ha. We have here the hypertrichosis or the hirsutism. Hirsutism or hypertrichosis is the excessive hair in the body. I'm not just talking about the hair sa ulo, but tanan klaseng hair. Okay. So for example, mao na siya ang class. Mao ni siyang dili nindot nga butang pag mogamit ka og hirsutism og minoxidil to increase your hair nga kadaghan, hair volume or hair growth. Nga naman, kung mag-shampoo manggug ka, di ba ang shampoo, maadto siya, sad na siya sa imuhang nawong, ang minoxidil manggo, dili lang siya para sa ulo. Kung asa nimo siya gibutang, matubuan jud kag hair dito. So kung imuha na siyang ibutang sa imong nawong, may ngana gid na imuhang nawong class. That's the problem with minoxidil. So it is also being regulated by FDA. Gina-regulate siya as antihypertensive drug, pero gina-regulate po siya sa cosmetics kasi again, grabe iyahang hirsutism. Excessive gyud ang hair sa any part sa imuhang body. Okay? Kung asan mo siya gusto ibutang sa mukha. Yeah, mabili siya sa pharmacy. You can even buy this one sa SM nga supermarket. Shampoo man gud siya, shampoo. Tawan ninyo ang shampoo na pag naganin na nakabutang minoxidil, it is for hair growth. But be careful not to place the drug to other parts of your body kay matubuan po nagbuhok din ha. Imong naong class mapuno gyud na og buhok. Okay? Questions? Wala? Dili na to gusto mingan niya tong naong. Next, we have the sodium nitroprusside. So among the vasodilators, mo ni ang powerful nato nga parenterally administered vasodilator. Forever na siya na-effect. Yeah, forever. Yeah, imuhang naong matubuan yun na pero may buhok. Bisag i-shave pa na nimo, matubo na ulit ang buhok. That's really the effect of the minoxidil. That is the reason why bisag naka-cosmetics na siya class, dili na siya actually under sa cosmetics. Though naka-shampoo siya, naka-cream or whatsoever na topical na application, dili siya under sa regulation sa cosmetics but under siya sa regulation sa drugs. Okay? Yeah. Kung asa nimo siya i-apply tin, kung sa ulo lang ka, tabunan nimo ang other parts sa imong lawas, dili man ka magkaroon og daghang buhok. Pero kung tanan imong ubutang na to sa imong tiil na siya, lagi na siya buhok class. That's the effect of minoxidil. Labaw na pag imo siyang inumon, kay tanan jud to parts sa imong lawas. Umapod na siya ang reason nga wala kay siya ginagamit as anti-hypertensive hypertensive. Pero board exam question, our drug of choice for hypertensive emergencies, the sodium nitroprusside, because this is very powerful. Unlike the other vasodilators na na-discuss na nato, sodium nitroprusside can dilate both the arteries and the veins. So very powerful. Panot siya. Pero be careful with the use of minoxidil ha, basig ang naong mapuno og buhok. Sa ulo lang gid ibutang ha. So again, sodium nitroprusside is given intravenously as infusion, and you cannot really see sodium nitroprusside nga ginabaligya anywhere kasi this is freshly prepared. Kailangan magud freshly prepared ni siya. Before siya gamiton, i-prepare siya sa pharmacist, and kailangan ibutang siya sa like sa amber bottle because this is very light sensitive. So kung ma-expose siya, maguba siya dayon. Again, freshly prepared and covered with foil before administration. Toxicities, syempre hypotension, this is a side effect. A shock also is side effect. When you say shock, there will be a sudden decrease in the blood pressure. So since madilate tanan arteries of veins, grabe gid ang pagbabaan ni sa blood pressure class mo na ginagamit lang siya for hypertensive emergency. And ang sodium nitroprusside, naana siya ay cyanide sa iyahang chemical structure. So pag masubraan ng patient, there will be cyanide poisoning. So let us be careful of using this drug, and that is the reason why we cannot see this preparation anywhere. Again, freshly prepared po ni siya. And then we have the diazoxide. The brand name is Hyperstat IV. It is also given parenterally, pero dili siya pareho sa nitroprusside kay arteries lang iyahang kaya i-dilate. But nevertheless, we also use this for hypertensive emergency kay ano man siya, IV man siya ginahatag. Board exam question about diazoxide. Ang iyahang chemical structure is similar to the thiazide diuretics. Again, similar sa thiazide diuretics ang iyahang chemical structure, pero si diazoxide has no diuretic activity. This one is a board exam question. Okay? Toxicities, syempre, expected yun na siya class hypotension, and it can provoke stroke, myocardial infarction, and angina. Due to the decrease in the blood pressure, there will be tachycardia. And aside from that, na siya yung adverse activity na inhibition of insulin release in the pancreas. Again, na siya adverse activity na it can inhibit the release of insulin in the pancreas. Therefore, na siya extended nga gamit, diazoxide can be used to treat hypoglycemia secondary to insulinoma. When you say insulinoma, the patient is making and secreting too much insulin. So pag daghan kay kag insulin sa imong body, syempre you will experience hypoglycemia. Okay? Daghan man kay kag insulin, daghan kay manghinlo sa imuhang mga blood sugar din ha. So mag-hypoglycemia ang patient. We call the condition insulinoma. The pancreas is very active for this. So to inhibit the release of the insulin in the pancreas, we can use the diazoxide. And we have here phenoldiazepam. Again, from the name itself, you should know that it is an analog of dopamine. And just like the other vasodilators, ano lang siya, arteries lang ang iyahang madilate. Pero kay IV man siya ginahatag, so pwede siya gamiton for hypertensive emergencies and during operation, surgical operation wherein the patient experiences hypertension. Okay? Mechanism of action, again, since dopamine man siya analog, so iyahang action is on the D1 receptor. That's the specific receptor kung asa siya mag-act. And activating this D1 receptor can result to the dilation of the arteries, and at the same time napod siya natriuresis na activity. When you say natriuresis, there is excretion of more sodium in the urine. Toxicities, the same thing. Reflex tachycardia. Ang inyong tandaan ha, pag nagababa ang BP, nagataas ang heart rate. And then there will be headache. Remember, there is vasodilation. Flushing, when you say flushing, kanang, because of the vasodilation, init bitaw ang feeling sa patient, mamula niya init. That is vasodilation. Ang cause gihapon sa flushing. And there will be increase in the intraocular pressure, thus we cannot give phenoldiprem to patients with glaucoma. Okay? Any questions so far? Wala. So, I think this is where we end. Tomorrow, I will continue with the calcium channel blockers. And what else? And I'll be discussing, yes, the angiotensin. And that will be the end for the hypertension. Dili na lang sa day ko mag-quiz tomorrow, kaya medyo taas-taas. We will have our quiz on Monday about the antihypertensive drugs. Tanan. So after my discussion with the CCBs and the ACE and the angiotensin drugs, I'll continue with the drugs for heart failure after. Okay? Questions before ta mag-end? Okay.